Hi, welcome everyone. Welcome to the third class of the 5 series of prenatal education sessions. My name is Catherine Hillier and I'm a registered dietitian here in La Ronge.
I'm Brooke Graham. I'm the Prenatal Outreach Coordinator for Kids First North in La Ronge.
Today we'll be going over who has your back and speaking of some support systems during your pregnancy. You can feel free to have a notepad and a pen and paper and write down any notes as we go along for the presentation. If you have any questions, feel free to visit the NHCP website. This presentation is meant to give an overview of some important points about having a baby. So if you have any detailed questions or any concerns or are worried about anything, please see your healthcare provider.
So some things we're going to go over in this presentation are local contacts, seeing your healthcare provider, making plans, what to do in the arrival of any complications. We want to talk about some mental health support, as well as diabetes in pregnancy, syphilis, and HIV in pregnancy as well. So it's important to see your healthcare provider as soon as you think you're pregnant. At your first visit, you may be asked about your health, your lifestyle. Your due date will hopefully be established. That's sort of an estimate. And then your support people. Your care provider might have some more in-depth questions as well, but it is just a time to talk with them. And it is really important for you and for your pregnancy to see a healthcare provider.
Some questions for your healthcare provider may include, can I be your patient during my whole pregnancy? You may ask questions about what foods are safe to eat, how much weight you may gain, and other questions or concerns related to complications during pregnancy. You may ask for other support that you can find in your community to help you throughout your pregnancy to keep you and baby safe.
Mm-hmm. Some of those things might be like needing some extra support to stop smoking, or if you need some help with drinking or any sort of drug use or something like that, you can talk to your care provider about that. Even questions like, can you still exercise during pregnancy, or any questions you have about sexual activity or anything like that, you can talk to your care provider about anything at that time.
And another question you may ask is where you can give birth to your baby.
So with prenatal care, there are a lot of medical tests that can be done. Some are very routine that need to be done for the safety of you and your baby, and some are optional. So talk with your doctor about those medical tests. If you have any questions about them, ask them. They are more than willing to talk with you thoroughly about those medical tests. And just so you know, every pregnancy is different, and so your first pregnancy might be different than a subsequent or second pregnancy, and might require some further testing, or there might be some new tests that weren't involved in your previous pregnancies. So just talk to your healthcare provider about the kind of medical testing that you might need.
And it's also important to understand that some tests aren't always safe when you're pregnant, so it's important to tell the healthcare provider, such as a dentist, when you visit that you are pregnant.
So sometimes complications do arise during pregnancy. That's why we do suggest that you are in contact with your care provider and seeing a physician or midwife or some regulated healthcare provider. There's a variety of things that you might experience during pregnancy. Some women tend to feel very nauseous. Some women don't feel very nauseous. And it is very normal for a lot of women to feel nauseous during their pregnancy. If it's very severe, then medications can help. You can always contact your healthcare provider if you have concerns or need some help. So another common experience with women is to have some vaginal discharge during pregnancy, but anything that's heavy, or if there's itching or any kind of odor, that can be the sign of an infection. And so seek care with your care provider. You will also be tested during pregnancy for STIs, which are sexually transmitted infections. And many STIs can be treated safely during pregnancy.
So during your prenatal appointments, your doctor will monitor your blood pressure, and high blood pressure can be a symptom of preeclampsia, but your doctor will discuss that with you and continue to monitor to keep you and baby safe during your pregnancy. It's important to get your flu shot every year during the flu season and your whooping cough vaccine. Having a baby is a very exciting time and a time of joy for a lot of women, but for some women that is not always the case.
Sometimes women feel very guilty because if they've had sometimes a difficult labor or pregnancy or experienced any sort of loss or anything in their life, they may not have those overwhelming feelings of excitement and joy, and they can feel very guilty about that. But just know that those feelings will come. And if they don't come, then getting some support, if you are feeling low for quite an extended period of time, or if you're feeling extremely fatigued and tired and those feelings aren't going away, if you're having any intrusive thoughts, something like that, please seek care. Talk to your doctor, care provider, or therapist.
Mm-hmm. And there are a lot of other support systems that you can go to, and we'll just go over a few that may be helpful for you in your life, like your friends and your family and your healthcare providers.
So some examples of some very common thoughts that women have after having a baby are, I feel like running away, I don't feel good enough, other people are better than I am, I'm not able to do this or that for my baby. I'm basically feelings of inadequacy and not being good enough. Those are some very common thoughts that women have, and it is important to give a voice to those thoughts and to talk to somebody that you love and trust who can help you with them.
So, as Burkett said, it is normal to feel these sort of feelings sometimes during pregnancy, and it's important to know when to reach out to your healthcare provider. So, if you are feeling down or sad for longer than 7 days, it is important to reach out to your doctor or your healthcare provider at that time. If things that used to make you happy in the past don't anymore, that may be one of the signs that you wanted to reach out to your healthcare provider and speak to them.
So if you have had mental health concerns in the past, it's important that you talk to your healthcare provider because you will likely be at a higher risk of developing some mental health concerns after your baby is born, which is okay, but you just want to talk to your healthcare provider so they can support you through that.
There are a lot of different ways that your loved ones can support you throughout your pregnancy. Talk about your feelings to your family or your friends or your healthcare provider.
You can talk to people who will celebrate your pregnancy with you.
And exercise with you.
Touch is something that is very important and that can provide a lot of comfort when you're struggling or not feeling great. So turning to loved ones for hugs, even for massage, for sore muscles, holding hands, something like that. You can turn to your loved ones for comforting touch.
Your friends and family can help you avoid alcohol and commercial tobacco and drugs to keep you and baby safe throughout your pregnancy. Healthy eating during pregnancy can help keep you energized and let you and baby grow at a safe rate. You can get your family and your loved ones to help prepare healthy foods with you, cook together, eat together at family meals, and enjoy foods together.
Your partner or support person can attend medical or prenatal appointments with you. Maternal mental health concerns can be very serious. That's why it's important to talk to your care provider. As soon as you think that you're struggling with a mental health concern, please talk to your care provider.
Overall, it's very important to take care of your mental health during your pregnancy. Some women experience diabetes in pregnancy. So if you do have diabetes during your pregnancy, it's important to note that your blood sugars may be a little bit hard to control throughout. If you have a chronic condition throughout your pregnancy, which is a condition that lasts for a long period of time, for example, diabetes, it's important to talk to your healthcare provider about different management methods to support you and baby throughout pregnancy. Gestational diabetes is a type of diabetes that may occur during your pregnancy. Some risk factors may include if you have a parent or a sibling that has type 2 diabetes, if you've had gestational diabetes during your last pregnancy, you may be more at risk of having gestational diabetes in your next pregnancy. Gestational diabetes usually goes away after pregnancy, but it's really important to make sure that you take the appropriate management methods with your healthcare providers throughout your pregnancy. You can talk to your dietitian or your diabetes nurse educator to help you manage your blood sugars and keep you and baby safe.
The management and treatment of HIV has changed a lot over the years. You can have a healthy baby and healthy pregnancy if you are HIV positive. So it's really important to take care of yourself, eat healthy foods, and take your medication. There's a variety of testing that your doctor will suggest and provide during your prenatal appointments. One of those tests is actually for syphilis, which is an STI that is actually on the rise in Saskatchewan. It's important to know that syphilis can be treated, and it is a particularly can be a particularly dangerous STI during pregnancy if it is not treated. So getting treatment is crucial. So talk to your doctor about that, and also your partner would need to be tested as well and treated for syphilis. To prevent long-term consequences for your baby and yourself, it is very important that you and your partner get tested for syphilis and treated, as well as engage in healthy sex practices like wearing a condom.
To summarize, today we spoke about different support systems who can help you throughout your pregnancy. And it's important to make sure that you talk to your loved ones, like your family or your friends, healthcare providers, community members throughout your pregnancy to keep you and baby safe. We also spoke about different tests that you will go through throughout your pregnancy. If you're feeling down or sad, it's important to make sure that you talk to your healthcare provider and get that support when you need it.
Maternal mental health concerns don't usually go away on their own, so seek out your supports, your healthcare provider, your friends, your family. Talk to people that you trust so that they can support you and get you the help that you need. For more information, you can go to the website Your Pregnancy Month by Month.
And there's also an app that you can download on Android or Apple, which is called My Saskatchewan Pregnancy, to keep track of your pregnancy.
Dancy, hello. My name is Flora Roberts. I'm from Kignac Friendship Center. I work with a prenatal nutrition program there as the coordinator. We are thankful and grateful that you're here with us, sitting with us today. We are thankful and grateful that you are here with us today, listening to us, sitting with us. We hope that you enjoyed this presentation of Who Has My Back. This is one of 5-part series of the prenatal classes that we are giving to you. Make sure that you find your support people who will help you with your exciting adventure of bringing a life into this world. We're so excited to see babies. Remember to go to all your prenatal appointments. Take care of yourself. Take care of your baby. Just be there. Be present. Because you are the teacher of your baby, even the one that's inside you. Take care of yourself. At this time, I'd like to say a little prayer. Upmachi huyu, nimushumak, igwa nukumak. Utiga pichigwa panok, sawanok, pagasimanok, igwa kiwitnok. Creator, grandfathers and grandmothers who sit in the 4 directions, the east, the south, the west, and the north. Ipagosidimetak, kitapiwichi hiak. Tantutamak, igwa kita pitamak igwa kawita muyak. We humbly ask to help us listen and hear what is being said. Wichi hinan mina kanuidiminan hanuchkagisigag mina tatugisigaw. Help us and keep us safe this day and every day. Nanaskuman upmachi huyu kapi midiak kamedasikiwai. Thank you, Creator, for all that you've given us.